This is a drive-through coronavirus testing site in London for health workers. It may look impressive, but those trying to get tested here are far from impressed.
And we've been here since just after 12 queuing, it's now 1, and we've moved about 3 or 4 cars forward in an hour, and there's probably 20 in front of us, so I don't know what the problem is. I mean, my wife could swab herself if they'd pass other things. She could do it in 2 minutes.
The government's now told hospital trusts to test as many staff members as possible, as well as patients. Dr. Nima Gadiri works in a major London hospital. His cough means he's been self-isolating for 14 days, but hasn't heard anything about getting a test.
I mean, it's a mixture of disappointment and anger, really, because they've been saying Matt Hancock, the health minister, has been saying for over a month that, they're going to bring in testing, but it just seems to be a repetition of kind of hope that it's going to come in without it actually being delivered.
We were told today it will be delivered.
The intention there, as I say, is to go from tens of thousands to hundreds of thousands. That will have to go on the basis of the priority that is identified as to which of these workers are actually needed. When I say workers, they're really staff or colleagues, are needed in which settings, particularly where the sickest patients are.
Ministers say there'll be 25,000 tests a day available by mid-April. Capacity now is around half that, under 13,000, but in the past 24 hours, fewer than 10,000 actually took place. The Department of Health says a total of almost 153,000 people have been tested since the crisis began, but only around 2,000 frontline NHS staff have been tested. But getting hold of testing kits has become a problem as shortages cripple the system.
Hospital trusts and other trusts on the front line have the infrastructure in place. They've got the labs, they've got the testing facilities, they've got the drive-through units in some places. They just need those supplies in order to make them work.
This mammoth temporary hospital about to open in London illustrates just how crucial it is to test health workers and get them back to work. With 4,000 beds, it'll need 16,000 members of staff.
The resource that is scarce is a critical care nurse and critical care doctor, particularly the critical care nurse. There will be a need to change the nursing model that we have traditionally used, where one critical care nurse looks after one critical care patient. And we're going to have to change that so they've got oversight of more patients, maybe even up to 6 patients at a time.
When this place opens, and indeed as the crisis deepens, every NHS worker will be crucial. Only by testing them can we ensure they can work. Emily Morgan, ITV News.